how would you explain what is this thing called OCD?
Well, I guess this again depends on the treatment approach that you are going to pursue with your client. But in essence, like if I were to summarize it briefly, I would say that OCD is the experience of having really distressing thoughts, images, unwanted urges, perhaps, that feel very, very real, that feel very, very distressing and anxiety provoking for the person, that do feel like an assault on themselves. I tell my clients often that no one has OCD about whether or not there is junk mail in the neighbor's mailbox, because I could not pay you enough money to care. And no one cares, or no one has OCD about what's going to be in their birthday present or their Christmas stocking or their Hanukkah gift, because those are pleasant things to think about largely.
Welcome to OCD Whisperer Podcast show. Today with me, I have an incredible guest, Rachel. She's a psychotherapist in private practice in Scottsdale, Arizona, specializing in the treatment of OCD, anxiety disorders, panic disorder, and trauma. Offering a clinical repertoire that creates change and ensures meaningful results, Rachel has achieved advanced training in cognitive behavioral therapy, exposure and response prevention, and inference-based cognitive behavioral therapy for the treatment of OCD and anxiety. Rachel lives in the Sonoran Desert with her family, her horse Gabriel, and a menagerie of beloved pets. Well, welcome to the show, Rachel.
I'm so happy to be here with you today. Thank you for having me.
Absolutely. So you and I are colleagues actually from a group practice, and I'm really excited to have you on because you and I talked about the different iterations of OCD themes that we've worked on over the years.
Yes.
And one of them is, I will say, and I'll kind of give this disclaimer now for folks, pedophilia OCD. And we're going to reference it as POCD moving forward, just because of, YouTube and other platforms sometimes will flag things. So unfortunately, due to those algorithms, we're going to do that, but it's not because we're avoiding anything.
We are not avoiding anything.
That's right.
We know that is not the answer.
That's right. And I think what I'd like to do is kind of dive right into just understand a little bit about how does this actually show up for people who have OCD. I'm sure you and I both know that the general public, when you don't fully understand OCD and kind of what it is, and you hear something like that, right? People often have a lot of strong judgments and opinions. And of course, you as the sufferer will feel shame and guilt and all sorts of things.
Right.
But I think, can we unpack that a little bit? Like, what is it really? What is POCD? What can we say to the people and to the general public who don't understand what that is? Maybe it's a big question to start with, but let's see what we get.
It's a big question, but I think you and I can tackle it together. So I think the first point I would make about POCD is that while, yes, in the general public, it is a lesser known form of OCD, it's actually really, really common. And I would guess over the years that I've been treating OCD as the primary component of my practice, that probably 40-50% of my clients have at one time or another experienced that subtype of OCD. So it's very, very common. But the P part of POCD is a word that scares people. And because of that, there can be a lot of misunderstanding about what POCD is. And that includes people who are actually suffering from it, who are very frightened and ashamed of the kinds of obsessions or obsessional doubts that they're having. And so that lack of public awareness combined with just the incredible distress that the obsessions themselves cause can really make people very, very afraid to get help.
Absolutely. And, as you're talking, one of the things that immediately comes to mind, there's been a couple of incidents actually within our own kind of OCD community where a colleague was talking about this and somebody else came in the public, who's actually a pretty big person, and kind of started saying things like, oh, well, this is just a cover up for people who really actually want to do this, or this isn't a thing, right? This is actually, again, like some really convincing or really like a story that's convenient. What would you say to all
Correct.
that?
Well, I think I remember very clearly what you are talking about. And as a therapist and a person with lived experience of OCD, that was devastating to observe. And I think that what drove, at least in large part, that whole episode is a misunderstanding about the difference between ego syntonic and ego dystonic thoughts. And obsessions are, by their very definition, when we're talking about them in the context of OCD, they are ego dystonic doubts, thoughts, fears, intrusions. The word you use kind of depends on the approach that you use to treat OCD. But for the purposes of our general conversation, an ego dystonic thought is a thought that collides with who the person knows and understands themselves to be. The thought is distressing. The thought is scary. It might feel shameful or disgusting. It is not something that the person is thinking on purpose because they enjoy it. It feels like an assault to their sense of self. And a person who actually has an interest in children in that way, their thoughts are egosyntonic. They enjoy thinking about them. And that is not what we are talking about with any form of OCD. People who have OCD, they feel as though they are really held captive to these thoughts that are very upsetting to them and that they don't want to be thinking about. And they will go to great lengths to reassure themselves or to try to make sure that these thoughts are not real or true. And that's where the rest of the condition unfolds with compulsions and things of that nature, avoidance, like we mentioned at the top of the hour. But these obsessions are ego dystonic. They are upsetting to people. They don't want to think them.
As you're talking, and so like I understand this thing. Thanks for explaining that, right? Because I think people will hear egosyntonic, ego dystonic. I mean, we know what that means, but I think for the general public, they might not know what are you talking about. So that was great to break it down like that. And I think as you're talking, I can already hear no, because we both know OCD brain. Right. The first thing that's going to come after that is, oh, but what if I do like it? What if I do want it? And really, I think severely questioning and doubting their own intention, their own desire.
Sure. Correct.
So,
Their own,
can we
that
unpack that?
sense data that is available to them in the moment of what they actually do like, do enjoy thinking about, what's upsetting to them, what's not upsetting to them. And really questioning all of those things. And that's what makes this disorder so heartbreaking for people, is that they come to believe that they can't trust what is in front of them, the information that is available to them in that moment. And they will, just go to such devastating lengths to try to disconfirm these scary ideas. But yes, that's why I think a lot of people who suffer from this form of OCD, if they end up going, screwing up the courage to talk about this and to go see a therapist, if that therapist doesn't know what they're listening to, if they aren't able to identify this as OCD, the presence of these, ego dystonic obsessions, obsessional doubts, the presence of these compulsions, they may end up getting, as a therapist, pulled into trying to debate this, reassure this, use a lot of logic to argue the person out of it, or may really misunderstand what they're hearing altogether. And so that's why I think, especially for a lesser known form of OCD, I just always have in my heart a deep wish that that person finds their way to an OCD specialist who can help them understand what it is they're going through.
Yeah. And if, let's say, they do finally find that person, what would you say, just in your experience and what if you were going to explain, like, what is this thing called OCD? I think that's a big thing that people attempt to explain. And I think sometimes it goes well. And what I see is sometimes it kind of goes right over your head because, when what I'm seeing is like when we're the ones in it and doing the work, we understand a lot of these concepts so well.
Sure.
But when, again, you're dealing with like the general population, what you think is an easy explanation, they actually look at you like, what? And still might not fully understand it. So I'm just curious from your experience, how would you explain what is this thing called OCD?
Well, I guess this again depends on the treatment approach that you are going to pursue with your client. But in essence, like if I were to summarize it briefly, I would say that OCD is the experience of having really distressing thoughts, images, unwanted urges, perhaps, that feel very, very real, that feel very, very distressing and anxiety provoking for the person, that do feel like an assault on themselves. I tell my clients often that no one has OCD about whether or not there is junk mail in the neighbor's mailbox, because I could not pay you enough money to care. And no one cares, or no one has OCD about what's going to be in their birthday present or their Christmas stocking or their Hanukkah gift, because those are pleasant things to think about largely. So people's obsessions are always about things that are very important to them, like who they are as a person or safety, just well-being of themselves and people around them. And they're always about things that are not just important, but distressing as well. So the presence of this obsessional experience causes a lot of anxiety, a lot of distress, and then the person will engage in what we call compulsive behaviors, which are typically very repetitive behaviors that they are engaging in to try to eliminate the fear, anxiety, disgust, shame that their obsessions cause them. And so many people conceptualize OCD as a cycle. The more compulsions you do, the more you may end up having obsessions, or at the very least, the more compulsions you do, the more anxiety you will end up feeling over time. And so in essence, it's that presence of obsessions, anxiety, compulsions, grief relief, and then we're back in it again.
And what would you say, do you know, like when people look at because people often ask questions like, well, is it biological? Is it genetic? Like, is it because of trauma? Yeah, I guess what's your sense with that?
I try to be humble when I answer that question, because the reality is that we don't know precisely. There appears to be some genetic propensity for it. I certainly have had clients where there has been lots of OCD that they can observe within their family structures. Some people's OCD does seem to take on the flavor of traumatic experiences that they've been through, and whether that OCD would have emerged anyways, but looked like something different, were that trauma not to have happened, is sometimes something that we can't answer. So I think the bottom line is that it's complicated. There's probably a genetic component to this. There is possibly a learned family environment component to this. Trauma, I think, just overall makes people vulnerable to all kinds of things. And so I think the answer is really complicated.
Yeah, definitely. I mean, I agree. I think it's for sure from what we understand so far, especially when we do see it in families, right? So there is an indication, there is that genetic component piece or biological part of the brain. And then
Sure.
also, like you said, absolutely, I think the environment, the learning, all of those pieces go together. Because like yourself, right? Like I've seen clients with no trauma history and have severe OCD.
Right.
Inversely, I've seen clients with, pretty serious trauma histories and sometimes moderate OCD. So the combination of things, I think, just really does depend. But how does OCD start or develop? Yeah, I think there's a predisposition, and then you take the environmental factors, the learned behaviors, the other pieces, you put it all together. It's like a perfect storm.
Correct. It's like a perfect storm, and it tends to arise in people at developmentally sensitive periods of time. So in adolescence or late childhood. And then oftentimes, I don't know about you, Christina, but whenever I'm working with a client who's about to, say, move out and go start college, that's a really taxing developmental experience for people. And that stress can cause symptoms to intensify in a big way. And so I think that it's a really complex, perfect storm with lots of different pieces. And like you said, trauma, we know for sure that, trauma doesn't 100% cause OCD, because otherwise everyone who had been through trauma would have it. So that can't be the only answer. I don't know that any of these things are the only answer.
Absolutely. I think also, when we're talking back to POCD, just like with any other theme, if you will, right? If it's any sexual topic at all, or any aggressive or harm topic, any topic that I think additionally is something we also know in society, right? That there are strong opinions. We have certain, obviously, rules, right? Then if there's religion involved, morality, I think those are the other layers and pieces that all get kind of pulled in. And like you said, I think a big part of it is we do get a little stuck on, oh my gosh, but what if I could be this person, right? Or what if I am that person somehow unbeknownst to me? And that's such a, I think you used the word appalling, right? Difficult concept to sit with, that I could be this horrible, horrible human. And then of course, people arrive at these places of, oh, well, then I don't deserve X, or I shouldn't be around, or I shouldn't then, I don't know, I don't deserve to even have any joy.
Relationships, joy. Yeah. I think in my experience, there is so often a significant experience of depression that can accompany this form of OCD, because the person believes, what is wrong with me that this is the kind of, obsession that I'm having? What must that say about me? And I think for therapists, this is a really important place, irrespective of whether you are an adherent of ERP or ACT or ICBT, our treatment alphabet, to recognize the difference between information seeking, which can be really helpful and therapeutic for people to understand what is normal, and to not have this idea that, the types of things they're experiencing are pathological or criminal. So information seeking versus reassurance seeking, they're not the same thing. And there are many important parts of therapy for someone who has OCD where they need developmentally appropriate information to help them understand what they are experiencing, and to normalize some of that, because people can have these ideas or these notions that the things they're experiencing are just, depraved. And oftentimes they're not. And so helping people to understand what they're actually going through is a really important part of therapy here.
Yeah. And I think to your point, right, also getting to that place of getting clear on also how do we even develop this thing called an identity, right? And how it is that I think with the OCD experience, we can start to over-identify with this OCD version of ourselves, really, and start to fear and think that, I'm this horrendous person, or I can't do anything, or I'm vulnerable, or I'm weak, or I'm broken, or whatever else that internal story might be about who you think you are.
Correct. Yes.
Yeah. I guess part of the question, though, if somebody's listening, they might wonder, well, what the heck do I do about this? Because this seems like, kind of a big animal, big beast to try to tackle, so how do you do it? What would you recommend? What would you suggest?
Well, the first thing that I want people to know, to understand about this form of OCD, as with any other subtype, is that this is a treatable condition. And there are people who have the knowledge and the training to help you, and to help you feel better and get your life back, and either reclaim who you are, or maybe start to find that out for the first time, depending on how long you have not been able to rest in who you are. I think if you are hearing this and some of these symptoms are familiar to you, a great place to start is the International OCD Foundation website, iocdf.org. Always want to give a plug for the foundation. They have a tremendous amount of information on their website. They also have a list of OCD therapists, psychiatrists, people who are trained to recognize and treat this condition and who will be able to know what they're looking at. I think it's always so important that people with OCD find their way to an OCD specialist. This is a very treatable condition, like I said, but it doesn't get particularly better with talk therapy or a lot of the other cognitive interventions that therapists may think to apply. And so you really do need to find someone who is able to recognize this, work with you to develop an evidence-based treatment plan, and to start working on helping you to reduce compulsions, reduce your level of avoidance, recognize these thoughts for what they are, be able to trust your senses, trust your sense of self, and to be able to build a life that you actually want to live in.
That's awesome. Well, first of all, thank you for just coming and talking about this topic. I mean, I think it's a big topic, like a lot of these topics, and there's nuances that we've hit on today. Last, I want to ask you, if people want to find you, if they are excited about this, they're like, yes, I'd like to get information, I want to connect with you, where can they find you?
Yeah, I'm pretty easy to find. You can find me at my website, which is www.ocdandptsdtherapy.com. I also have a Facebook page for my practice, and I put out content pretty regularly on my Facebook page just to keep people engaged and to provide information about mental health in general, OCD, trauma, panic disorder in specific. And that actually has the same name. It is also OCD and PTSD therapy. And I am here to help. I have such a passion for people in our community, to help empower people and live beautiful, joyful lives. And it can be done. And so I guess the last and probably most important thing I want to say is that there is so much reason to hope. If this episode of your wonderful podcast reminds listeners of themselves, there is lots of reason to hope. And there are people who know how to help you.
I love it. Thank you so much for coming on the show.
Thank you, Christine. I'm so glad I got to see you today.